Hi, I'm Dr. Matthew Fazekas, pediatric sports medicine physician with U18 Sports Medicine at Joe DiMaggio Children's Hospital. Today we'll discuss the physiologic and metabolic changes that have occurred over the past several weeks as you've been staying at home, staying safe from the coronavirus. Oh look, here we have Dr. Sabinski, one of our pediatric residents. He too has been stuck but in the hospital over the past several months taking care of patients. Just as he's been unable to get to the gym and work out, his body has undergone changes from a physiological standpoint that will affect his ability to get back to the gym and back on the field. We'll discuss those in depth as we talk about the changes that occurred to your heart and respiratory systems, as well as from a metabolic and nutritional standpoint. So first, let's talk about what exactly is detraining. Well, this is the loss of training ability due to the physiological changes that have happened by staying off the field and out of the exercise room. The first thing that we see with detraining is a loss in VO2 max. This is the ability to use oxygen effectively with your muscles at your maximal work. This decrease can happen in as little as 4 weeks, even in highly trained athletes. Now, this decrease is due to several factors, the first of which is due to a decrease in blood volume. This is the biggest contributor to your reduction in VO2 max, and the loss of blood volume due to deconditioning can take place in as little as 2 days. The next thing that we see is an increase in your heart rate. So as you get into your exercise regimen, you may notice that your heart rate maximums actually go up. And this is also due to a decrease in the blood volume as your heart pumps and tries to maintain oxygen going to all of your muscles. We'll also see a decrease in what's called your stroke volume. This is how much blood the heart can pump as it pumps each time. And this is decreased overall due to an overall reduction in that blood volume. You'll see changes in what we call cardiac output. This is how much the cardiac muscle and blood volume can go through the heart at one time. And this will decrease because the decrease in your stroke volume is actually bigger than the increase in your heart rate. So it's almost as though even though the heart is pumping harder, it can't quite get the amount of blood through the heart in any given pump. You'll also see true structural changes. So we'll see decreased cardiac dimensions with detraining in only a few weeks' time. And lastly, we'll see a decrease in your respiratory function. So you'll have decreased ability to blow off that carbon dioxide during maximal time of work. In addition to these physiologic changes that occur at the heart and respiratory systems, you'll see metabolic implications that happen. And one of the biggest things that we see is the increased need for carbohydrate as your energy source. Now, typically with exercise, you can have fuel in the form of simple carbohydrates, more complex carbohydrates, what we call glycogen, which is basically, built up blocks of simple carbohydrates, and then also fats, your lipids. Well, in deconditioned settings, you actually see an increased reliance on your simple carbohydrates. You'll see decreased glycogen stores, which really imply, in effect, what you should be keeping a focus on in terms of your nutritional status as you get back to play coming from a deconditioned state. So next up, I'll throw it over to Dr. Michael Dressing, one of my partners, and he'll discuss more of these implications.
Thanks, Dr. Fazekas. So like he said, I'm Dr. Mike Dressing. I'm one of the other pediatric sports medicine doctors at U18 Sports Medicine and Joe DiMaggio Children's Hospital. I want to ask you guys, how can we safely resume conditioning and getting back into shape? So first, I'd like to focus on two critical aspects of your life with regards to this, and that would be your nutrition and your exercise. So with regards to nutrition, there's metabolic changes that happen in athletes' bodies and how they store and use energy after periods of deconditioning. Exercising muscles rely more on carbohydrates because the fat metabolism decreases. The body also loses some of its carbohydrate stores, and it's not as effective as absorbing some of those carbohydrates that are in the bloodstream. So if you tweak your eating habits a little bit, you can adapt to these metabolic changes. Eating carbohydrates more frequently, but in smaller portions, is one way to adapt to this. Decreasing the amount of fats in your diet is another way. Maintaining a steady intake of protein is also important. Now, some people were probably overdosing on protein when they were lifting a lot, and while you haven't been doing that, you still need to have a steady amount of protein to stay healthy and help those muscles grow. Iron is another key component in hemoglobin, which transports oxygen to some of those tissues, and so it's important to get enough iron in your diet as well. Now, with regards to exercise, the best way to prevent the effects of detraining is to never stop. But at this point, let's assume that you've been watching Netflix too much and there's an indentation in your couch from where you've been sitting all day. When you return from a break, it's important to realize your body is not going to be in the shape that it was before when you stopped. Always remember, when you start activities, you need to warm up and you need to cool down after exercise. This doesn't have to be a lot, but if you do it for a few minutes each time, this helps to prevent some of those injuries from occurring. Initially focusing on some of your core workouts and balance is also very important to all sports, and that's a good place to start. The next place I would say to start is working on your cardiovascular fitness. So this is running, this is working on the stationary bike, this is getting your heart rate going to combat some of those effects that Dr. Physique has talked about before. So the best way to do this is start with low intensity and high frequency or high repetitions, long duration workouts where you're not necessarily maxing out, but you're trying to sustain something for a longer period of time at a lower intensity. Keep in mind, increasing your intensity too quickly can also be harmful. As a general rule of thumb, we'd suggest not increasing the frequency, the intensity, the activity, the weight by any more than 10% per day to help you guys return to sports without getting hurt. Now, working on your aerobic or your high intensity and your high strength training is where I go to last. And I think that's very important to get back to sports, but we want to make sure that you have a steady foundation before you kind of go into these high intensity workouts. Now, another thing is staying hydrated. So choosing to drink fluids as you work out is very important, especially when we're talking about the heat of Florida over the summer. So when you're working out, choosing water is great, and you definitely want to stay hydrated before you work out. But when you're working out for at least 45 minutes to an hour, or you're getting into these high intensity workouts, you want to have something that replaces the electrolytes as well. So something that replaces those electrolytes is good to have, every 15, 20 minutes as you're working out, and then definitely getting some good hydration in after you work out is important as well. As we've discussed today, there are many physiologic and metabolic changes that happen in the body with deconditioning and detraining. Preseason training is critical for athletes to help prevent muscle, bone, and heat-related injuries as they get back into shape. Tweaking your nutrition strategies and slowly increasing your activity level can help prevent this from occurring and help you get back to sports safely.